public health recommended keeping the schools closed for longer than the government decided to do? And if so, why did you choose to go against those recommendations?
Well, there has been discussion over the different strategies and possibilities. And I must say that personally, I recommended that we don't close the schools too long because of the important side effects of closing schools, primary schools especially, but also the impact on secondary schools. But there have been discussions over how long should we or when should we reopen them. But we were favorable of keeping that interval as short as possible, depending on the epidemiologic status within the communities right now. So this is the discussion that took place. It's not an easy decision because you have to balance the risk within the community and the side effects or impacts for the parents and for the kids.
And just as a follow-up, what level of transmission in the community would it take for you to recommend schools to stay closed for in-person attendance?
Well, we didn't state on a specific level of transmission. Right now, we feel that the level of transmission is quite high, and that's why there's been a recommendation to have a curfew and other community measures to limit transmission. And we think that those community measures with the curfew are by themselves very good tools to limit transmission. And I add something which is very important: if people respect them, because the problem is not the fact that those measures are good or not. They are good, they are functioning, but if people think that the situation is not so important for them and for the others that live the consequences of transmission, then we are in a difficult status. So you have to be careful not to punish or impose very severe constraints on people that are not the cause of transmission. The kids are kind of victim in that situation right now. So that's why we want to place really the measures on the places where the risk of the higher risk of transmission occur. And this is not in primary school. I don't mean that there's no transmission. There are transmission. There have been outbreaks. There could be outbreaks still. We are taking all the measures to control them very rapidly, but they are limited and they are not the cause of the actual situation. So there's no specific level that I can point off at this moment to do that. Obviously, if there was still uncontrolled transmission, there could be stronger measures that would be considered by the government.